Ladies and gentlemen, thank you for your patience, and we are back online with today's briefing from Dr. Alex Garza with the St. Louis Metropolitan Pandemic Task Force. Dr. Garza will resume his comments from the top, and then we'll move into questions that we have received from members of the media. Thank you for your patience, and Dr. Garza, please proceed.
Thank you, and good afternoon, everybody, and apologize for that inconvenience. So I hope some of you had a nice break this holiday weekend and a chance to reconnect with your families and friends, albeit remotely. Today we are beginning our second full week of briefings with the COVID-19 pandemic. Personally, I want to reiterate how much those of us in healthcare appreciate the attention that the news media is paying to the pandemic and to the people of the region for paying attention to the issue as well. The media has asked some very thoughtful questions and has continually sought to do anything that they can to help stop the spread and save lives, and we appreciate that very much. So we continue to believe, though, that we're still on the steep part of this curve, and there's no question that the widespread use of our scientifically proven behaviors has helped us reduce the spread. Had we not taken those important steps weeks ago, we would have been in a much more difficult situation right now. But I want to be clear that we're still very concerned about the virus circulating in the community. It's still there, and it still poses a risk to our families, friends, and neighbors, and it will continue to grow. And as I said a week ago, there's no question that the virus is still going to hit this area and hard. But exactly how hard depends on what we do as a community. I know it's easy to get frustrated or to be tempted to gather in larger groups, especially given the warmer weather. However, I can't stress enough that we're reaching a critical time right now, and we can't let up. We have to keep doing what we're doing, staying at home, washing our hands, cleaning surfaces often, and practicing social distancing whenever we're around other people. So here's the latest update on our data. And again, these data are the combined figures of the four major healthcare systems that are part of the task force, including SSM Health, BJC Health, Mercy, and St. Luke's. Hospitalizations are up compared to yesterday from 607 patients yesterday to 634 today. However, the number of patients in our intensive care units is down. It was 211 yesterday, and today it is 189. And the number of patients on ventilators is about the same. Yesterday we had 162 people on ventilators, and today there are 160. Across the hospital systems, we had 43 COVID-19 patients discharged from our facilities. Since we started these briefings a week ago, the inpatient COVID and patient under investigation numbers are up around 35%, so we're definitely still on the rising side of the curve. And with all of that now, be happy to address any questions we may have received.
Dr. Garza, are you worried about seeing a potential spike in cases 2 weeks or so from now because people got together during Easter?
That's really difficult to answer. So part of it depends on how many people came together for gatherings on Easter. From what I observed and from what my family and friends said to me, I think most people observed the social distancing rules, and so I don't anticipate any rise, but certainly it's possible.
What advice are medical systems giving to patients who have recovered? Is there follow-up being done once they're out of the hospital?
Mm-hmm. So the follow-up would be normal follow-up care from post-discharge from a hospital, especially from intensive care. And so that would be following up with your primary care physicians or some other physicians that might be directing care. And then we're working through programs as well for people that are uninsured or don't have a normal primary care physician on how can we get them seen in other types of clinics for follow-up care.
According to some internal tracking that is being done by one television station in the St. Louis region, the reported positive cases have gone down for the past 3 days in the region. And this TV station is saying that that's the first time that's happened since they started tracking cases in mid-March. Is that a trend that you're watching as well? Is the matter of decreased testing or decreased test results over the Easter weekend Is it an indication that it was the Easter weekend, or have we potentially turned a corner? And if not, how will you know when there is a downward trend?
So the testing data is a little bit difficult to interpret, and the reason why I say that is the testing that's done out in the community will go to a private lab, and it usually takes anywhere from 3 up to about 7 days to get those test results back. And so then it matters when that test is posted. So for instance, if someone goes to their physician today and gets tested for COVID, if it goes to that private lab, then we won't have the results back for a number of days. And so it's a lagging indicator, and they come in at various times. So looking at positive test results from day to day is a little bit difficult to interpret. So what we will want to look at is trends over larger blocks of time than really from day to day.
Are doctors or hospitals able to provide any broad categories of those who are testing positive now, or is it a seemingly random mix of different backgrounds or professions, things like that? The reporter is asking the question, wondering, if there are those trends, because we're now several weeks into stay-at-home orders.
We don't have data down to that level of granularity yet. The major healthcare systems are working together to pool data so that we can start looking at what those trends might be according to a geographic location or age or any of a number of other variables. But as of today, we don't have that level of sophistication to look at those types of trends.
What is the latest update from the task force on how many daily hospitalizations they need to be prepared for? Last week, you indicated it was between 1,300 and 3,300 a day. Is that still the case, or what is a current projection?
We run our models, and so you hear me talk a lot about our models. So we run those every week. So we are continuing to run those, and we've gotten the results back today, and we're going to be analyzing those results and should be able to give some more accurate projections or some updated projections later on this week.
Thank you, Dr. Garza. That concludes the questions that have been submitted by members of the media prior to today's briefing. As we shared earlier, if we receive additional questions after the briefing, we'll work to address those as quickly as possible this afternoon. And starting tomorrow morning, we will begin to collect questions for tomorrow afternoon's live stream. Thank you very much for tuning in.